when we finish. And I would ask Ms. Johnson, if you would you just come up here and tell us about yourself? If you'll go talk to us from this podium over here, we can hear you. And I believe you've been on the board, so you can tell us how that's going.
You ready?
Oh, yes, ma'am.
Well, I'm Nancy Norris Johnson, and I've been a nurse for 35 years, and I've worked in Hattiesburg for 26 years. I reside in Summit. My husband is a pastor in Summit, and I've recently was married to him, so I moved to Summit. And during my nursing career, I worked at Forest General with the cardiac unit, and then I went to endocrinology, and I spent 26 years in endocrinology. We started the program at Hattiesburg Clinic. And after that, well, during that time, I worked for Medtronic with the insulin pumps. I am a certified pump trainer, and I continue to work with the pumps. I work also PRN at the hospital in Macomb.
And how has your time on the board been? And
I have been on the board. This will be my second term, and I come in on a half term. So I've been on the board for 6 years now. And I love serving on the board. I love protecting the citizens of Mississippi.
And do you have opinions about the Board of Nursing and the department and how well things are going at the?
I think the board is doing great, and they serve in so many ways for the state of Mississippi. I mean, there's so many outreaches that we serve, and we stand in this, on the middle ground.
Could you tell us more about that or give us an example?
Well, like we go out and do talks. We are there for the people of Mississippi. We're there to protect and the safety of the citizens of Mississippi, as well as the nurses. We stand for the nurses.
Well, thank you. And I want to explain to you and others, there are some boards that we really appreciate having people come visit with us personally, because we think those boards are particularly important, things like the College Board and the Board of Health and the Board of Nursing. And so I know that you went to some effort to get here. I know it was very short notice. It's sort of a chaotic time around here. But thank you for coming. Do members have questions, comments? If not, is there a motion? There's a motion that we advise and consent. All in favor say aye. All opposed, no. The ayes have it. Thank you, Ms. Johnson.
Thank you.
See there, I told you it wasn't going to hurt. Won't feel a thing. Our next nominee is Ms. Clanton. Ms. Clanton, would you also just come up and visit with us briefly, please?
Good morning. My name is Janie Clanton. I am a nurse. I've been a nurse since 2012. I actually work for Air Evac, which is a medical helicopter. I'm in charge of the base in Natchez. So that's kind of my background, is emergency medicine. Before I became a nurse, I was a paramedic on the ground for a long time, rural medicine in an ambulance. Transferred from a paramedic, got my nursing license, went to work in a rural hospital in the ER, and then transferred into flight medicine, which was kind of always my dream ever since I got into medicine. So a little bit about myself. I'm married. I had 5 children. My oldest child passed away 9 years ago last month. She had cancer, and I know some of that stuff shows up on the background, where we fought cancer for a while with her, and we have insurance, but like so many Mississippians and Americans in general, insurance doesn't pay for everything. And when you're traveling back and forth from Houston and getting several hundreds of thousands of dollars in medical bills, something's got to give. So we paid what we can. People that worked with me, I paid what I could. The people that couldn't work with me, I told them they could get in line behind somebody else. So that's what you see on the background. It's the medical bills that we slowly paying down, but it takes a long time when you're talking, $1 million worth of treatments. So.
I don't mean to ask questions that are unpleasant, but would you be able to tell us a little bit more about your child who passed away and your ordeal trying to get coverage for that child? We don't need to know everything, but just some more sort of.
Jerry Catherine was our baby. She was our firstborn. And she was my baby. She was teenager, completely healthy, vibrant, full of life, and just got sick all of a sudden, and we didn't know why. And as being a nurse, a paramedic, and a mom, you're okay. Suck it up. Go to school. You're okay. It's just a headache. It's just a headache. It's just a headache. You're okay. Take Tylenol. Go on. Keep rocking. And it just kept getting worse. I was working with, we were working with one of the ER doctors. He goes, something's not right. So he went ahead and checked her in and did a CT, and that's when they found she had brain cancer. And it was advanced, and it was terminal. But, it's your kid. So we fought it. And we actually did really well. About halfway in, they looked like it might go away. And they told us, it's looking good, but now if it ever comes back, that'll be it. There's nothing else we can do. So we had about 2 months of really, really good times. And then it came back, and it came back hard and fast. And then we lost her a few months after that.
I think you said you went to Houston for treatment.
We did MD Anderson. MD Anderson and St. Jude, they talked. Jerry had a kind of a rare cancer that had never been seen in her age group. It usually was seen in 2- and 3-year-olds, and had really, they had fairly good success with it, but they had never treated a cancer with her age. 18 years old, they'd never treated one at that age with cancer. So it was experimental. Everything we did was experimental, and MD Anderson was good. St. Jude, those doctors collaborated, and they were very good, and she took it better than we did.
Well, thank you. I appreciate your sharing that with us. I know that the fact that you have these judgments raises questions, and I wanted you to come explain that to us. About 50 years ago, my mother had cancer, and we went to MD Anderson also for I assume the same reason, which is if there's something you might be able to try, you try. Questions? Senator Wiggins.
Thank you, Mr. Chairman. And believe me, I've said get in line too. I understand that. And thank you for doing this. Are you working, where are you presently working?
I work for Air Evac out of Natchez.
So are you practicing nursing currently?
I'm in clinical practice. I don't actually fly anymore, but I do the chart reviews. Basically, my job is to keep the helicopter in the air. So I do all the budgets, I do all the fuel, I deal with the pilots, I deal with the mechanics, I deal with the clinical crews, I do 100% chart review. That's just kind of on the top layer that I do. And then I'm employed part-time when I can get time at Franklin County in the ER.
And I certainly appreciate what your willingness to come and to serve and all that. I'm really, my question is going to be for you. Being on the board is, let's just say you're not going to get rich. It's time, there's time involved. As the chairman has brought up, there are these issues that seem to still need to be addressed. My question is, can you devote the requisite time? Because, and I'm asking that more for you than anything, but these positions are voluntary. Well, I guess they're different ones, but they take time and travel and stuff like that. And just want to make sure that that can be done.
Yes, sir. And I have been sitting since July on the board. My employer works with me. They do whatever I need them, that they consider this. They like to see us be involved in our community and our state, and they work with me 100%. So if like today, I told them I needed to take off for a few hours, completely fine. I've handed over the reins to my second in command, and they've got the keys, so they know what to do. So they 100% work with me.
Anyone else? Questions, comments? Is there a motion? Senator McMahon?
Ms. Clinton, thank you for coming here and sharing your story with us. It means a lot to me because I'm sympathetic to your story. I got hurt when I was in grade school, and my mom and dad both worked, but we didn't have insurance. And it was $20,000 in bills back then, which doesn't sound like a lot of money today, but in the 80s, that would have bought 2 Chevrolet trucks. And I saw my parents, and it wouldn't buy a piece of a Chevrolet truck today, maybe the back end of one. But I'm extremely sympathetic to the working people of this state that don't have access to healthcare, some type of minimum healthcare. And you had insurance and you were still overwhelmed. And I appreciate your courage coming here today, knowing that that was going to be an issue and come up. I really do. I'm sympathetic to you. Do you have any other children?
I do. I have 4 more children and 3 grandbabies now.
Yeah.
My youngest child is just turned 16 last week. And my next to oldest child, she is 27. So kind of stair step.
Yeah. Well, thank you. Your testimony moved me. I really appreciate it. Thank you.
Is there a motion? Oh, there's a motion that we advise and consent. All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. Thank you. Thank you, Ms. Clanton. Thank you, Ms. Johnson. I know y'all went to some trouble to get here, but we appreciate your doing that. This is an important board. Thank you. We will stand adjourned.